वेलकम टू मेरा संगीत पॉडकास्ट। अब आपके रूबरू हैं यूनाइटेड स्टेट्स में बहुत सालों से प्रैक्टिस कर रहे डॉक्टर विकास भतारा। आज एक बहुत ही अहम विषय पर डॉक्टर भतारा बात कर रहे हैं। चलिए सुनते हैं उन्हीं की जुबानी।
Kamal, today we'll talk about individualized blood pressure goals. There is a lot of miscommunication, or I can say misinformation regarding what should be the ideal BP, what should be target the BP for the control. It's a very debatable subject. All the guidelines are all over, but I'm going to try to make some clarity, and maybe I hope I will give some clearance to the audience or the listeners, but I hope they don't feel more confused after listening to me. But let's start and work on this thing to see if we can clarify many misconceptions of what is the ideal blood pressure or the blood pressure goal should be. Since 2017, American College of Cardiology and American Heart Association guideline recommends the BP of less than 130/80 millimeters of mercury across the board. And now American Diabetes Association guidelines has recommended the same thing of 130/80. It is partly due to a recent trial confirming that a systolic blood pressure of less than 130 lowers cardiovascular risk, that including for the patients with diabetes. But a recent American Academy of Family Physician guidelines recommends a loser blood pressure goal of less than 140/90 to all patients, with an option to tighten it to less than 135/85 based on the shared decision with the patient. And this comes from a meta-analysis showing that the BP goal under 135/85 reduces the risk for MI, but do not reduce mortality. Plus, these tighter goals increase adverse effects. Don't get distracted by the blur of the numbers. The guidance varies due to the differing priorities, data analysis, or the gap in evidence. So the problem is all these associations give these different numbers, and common people get confused. But I think the big caveat is continuing to use the clinical judgment and individualized care. That's where talking to your doctor and discussing your individual plan comes in.
Individual blood pressure goals क्या हैं? ये अब डॉक्टर भतारा से चलिए जानते चलते हैं.
By assessing the cardiovascular risks, then consider the patient preferences, patient's lifestyle, patient's life expectancy, risk of fall. All these things should be considered in making the shared decision making with the doctor. Keep in mind, lowering or reaching to lower the goal usually means adding one or more blood pressure medication and can lead to side effects like low blood pressure, hypotension, or electrolyte abnormalities extra. So the aim for the blood pressure less than 130/80 millimeters of mercury for many patients, especially those at the higher cardiovascular risk. That means they have a prior cardiovascular event, or they have multiple risk factors, or they have a kidney disease. Those people should be targeted for lower than 130/80. They can tolerate the treatment and they're motivated. Let's do that. Okay, let's go for 130/80. But you should also consider at the same time loosen the goal to less than 140/90 or even 150/90 if the downside likelihood outweigh the benefit, such as older patients, frail patients. If you give them more medications and they're going to have side effects, they're going to fall more, they have electrolyte abnormalities, you should be able to loosen them, go to 150/90.
ब्लड प्रेशर प्लान्स के बारे हमें जानकारी दे रहे हैं, क्या गोल्स हमारे होने चाहिए इस बारे में बताते चल रहे हैं। सो चलिए उनसे और जानकारी इसी बारे में लेते चलें।
And we need to reassess these goals periodically. That means you talk with them, go to your doctor periodically and talk about these goals. For example, don't shy away from a lower the goal if the patient does well, meeting the loser initial targets. If you initially loosen the target and then patient is doing well, and you think you can add one medication or two medications and he's doing well, just continue to do that. Continue to choose VP meds to improve outcome, like ACE and ARBs or calcium channel blockers or thiazides, which can lower the kidney disease and is beneficial in your diabetes. Go for those medications. Or to step up, consider combining moderate dose BP medication to try to limit side effects instead of pushing the dose of one medication.
कुछ हिदायतें डॉक्टर भतारा इस वक्त हमें दे रहे हैं. चलिए इसी विषय पर कुछ और जानकारी हम लेते चले.
So talk with the doctor, to add different medications instead of like maxing out one medication, and reinforce proper BP monitoring in the office setting. Make sure when you go to the doctor, you take your time for a few minutes and position your arm at the heart level so that you do not get the erroneous blood pressure readings in the office of your doctor. And I would suggest, if you can take the blood pressure at home frequently, do that. And explore other resources for treatment of hypertension, like lifestyle changes. Okay, you're reducing the lower salt in your diet, all those things, yoga, exercise. Those are the other options that they can explore. So hopefully this will help our listeners to understand why some doctors say 150 is okay, one say 130 is okay, and others say less than 130 is okay. So these are all different goals for different type of people. So I hope I have clarified a little bit more than I confused them. We'll see them in the next episode.
And that brings us to the end of this conversation with Dr. Vikas Bhatara. In case you have any queries, write in for sure at kaval@merasangeet.com. Stay tuned in for more right here on Mera Sangeet podcast.